All right, today we're going to tackle a condition that's pretty complex and honestly often misunderstood: cutaneous lupus. We're going to break down exactly what it is, how doctors figure it out, and what the core strategies are for managing it. So let's just dive right in.
I want you to just imagine this for a second. The very system in your body that's designed to protect you, your immune system, gets confused. It mistakenly sees your own skin as a foreign invader and launches an all-out attack. That's the fundamental reality for people living with cutaneous lupus. So what's actually going on here? Well, cutaneous lupus, or CLE for short, is an autoimmune condition. In the simplest terms, it's a whole family of disorders where your body's defense system gets its signals crossed and starts targeting the skin. And often, the trigger can be something as simple as going out in the sun.
Yeah, and it's so important to get this. Cutaneous lupus isn't just one single disease. It's really a spectrum of disorders. They can show up in a lot of different ways, but one of the key things that connects them all is photosensitivity, which is just an abnormal, over-the-top reaction to UV light from the sun.
So who does this affect the most? Well, the data here is pretty striking. CLE overwhelmingly affects women more than men. We're talking a ratio as high as 8 women for every 1 man. And this is especially true during their reproductive years, which really points to this complex dance between our genes, our hormones, and our environment. To really get a handle on CLE, you kind of have to meet its 3 main personalities. The condition is broadly broken down into acute, subacute, and chronic forms. Each one has its own unique features and, its own implications. Let's break them down.
First up, we've got acute cutaneous lupus, or ACLE. This is probably the one you've heard of. It's responsible for that classic butterfly rash, or malar rash, that spreads across the cheeks and the bridge of the nose. It's super sensitive to sunlight, and it tends to flare up whenever the underlying systemic lupus is active.
And this right here, this is the absolutely crucial thing to understand about ACLE. More than 80%, think about that, 80% of patients with this kind of skin lupus also have or will eventually develop systemic lupus. That's where the autoimmunity can start affecting internal organs. It makes that butterfly rash a really critical warning sign.
Okay, let's move on to the next type, subacute cutaneous lupus, or SCLE. This one usually pops up on sun-exposed areas like the arms, shoulders, and chest. Now, the big thing to know here is that while these rashes can be pretty widespread and are very sun-sensitive, they generally heal without leaving behind permanent scars. And finally, we've got chronic cutaneous lupus, or CCLE. The most common version of this is called discoid lupus, or DLE. These are these persistent, clearly defined patches or plaques that, if they're left unchecked, can cause irreversible damage. We're talking scarring, thinning of the skin, and even permanent hair loss if it's on the scalp. This is exactly why getting treatment early is so vital. When you see them all laid out side by side like this, you can really understand the different challenges. Take ACLE, for instance. It has the highest risk of systemic disease, but a low chance of scarring. On the flip side, discoid lupus has a much lower systemic risk, but a very high potential for permanent scarring. And SCLE, the subacute type, it kind of sits right in the middle of those two. So, how on earth do doctors sort all this out? Well, diagnosing CLE is honestly a bit like detective work. It's never based on just one single test. It's all about piecing together clues from the patient's story, a physical exam, and of course, lab results. To solve the puzzle, doctors follow a pretty logical path. It always kicks off with a really careful look at the rash itself. But to be sure, they'll usually take a tiny skin sample, a biopsy, to look at the cells under a microscope. At the same time, blood tests can spot specific autoantibodies, and a full checkup looks for any signs of internal organ involvement, all while ruling out other conditions that might look similar.
Okay, so once there's a diagnosis, doctors need a way to, keep score, to track how things are going. That's where something called the CLASI score comes into play. It's basically a standardized tool that helps objectively measure 2 different things: activity, that's stuff like redness and scaling that can get better, and damage, which is stuff like scarring that's permanent. It's a huge help for seeing if treatments are actually working.
Okay, let's switch gears and talk about the action plan. Managing CLE isn't just about putting out fires when they pop up. It's all about a proactive, multi-layered strategy to get the disease under control and, most importantly, prevent that long-term damage. The whole game plan really rests on 3 main pillars. First, and this one is the most important, is photoprotection. Second, you've got topical treatments,
creams and ointments that go right on the skin to calm down inflammation. And third are systemic antimalarial drugs like hydroxychloroquine, which work from the inside to help quiet down that overactive immune system.
I really want to pause on this because if there's one thing you take away today, this is it. Sun protection isn't just, a good suggestion. It is the fundamental therapy. This means high SPF, broad-spectrum sunscreen, wearing protective clothing, avoiding the sun when it's strongest. It's a non-negotiable, lifelong commitment. Period.
For most people, that first-line approach is enough to get things under control. But what happens when it's not? For those who have really stubborn or refractory disease, doctors then move on to second-line therapies. And these are stronger medications like methotrexate or mycophenolate that work to suppress the immune system even further.
So what does it actually mean to live with this condition day in and day out? The truth is, the impact of CSE goes way, way beyond just the skin. It can affect a person's entire quality of life. Because the disease is visible, it can have a profound psychological and social impact. Studies show high rates of anxiety and depression. The constant, relentless need to avoid the sun can make you feel socially isolated. And on top of all that, the physical symptoms, the itching, the pain, the fatigue, they all take a really heavy toll.
And this really brings us to the ultimate goal of management. The strategy is pretty clear. First, you use treatments to knock down that activity score, all that reversible inflammation, and get it as close to zero as you possibly can. And second, you do everything in your power to stop that damage score, the irreversible scarring, from ever going up. This is why starting treatment early and staying consistent is just so critical.
And that leaves us with this final and I think really hopeful thought. Research is moving incredibly fast. We've got new biologic drugs that can target very specific parts of the immune system. And all this progress raises a really exciting question. As we get smarter about this disease, could we one day move beyond just treating damage after it happens and actually predict and prevent it before it even starts? Now that is the future we're all working towards. Thanks so much for joining me.